Hello everyone. This video is a short video. Just want to clarify some doubts. As you all know, my mother is diagnosed with blood cancer. There have been many questions that why she is not being treated in Tata Hospital and why is she treated in a private hospital. I would like to share the experience which we had in Tata Hospital. The time we got to know that she is being diagnosed with blood cancer, the immediate thing which came into our mind was Tata Hospital. There was nothing else which we could think of apart from Tata Hospital. But when we visited Tata Hospital, we got a reality check. There are so many people around, so many people in Tata Hospital who are dealing with so much pain. Seeing that, I thought my mother's pain is less. But then the experience we had was terrible. As you all know, Tata Hospital is a cancer hospital, and there is no other hospital who can treat cancer patients as good as Tata Hospital. And with the same hope, we went to Tata Hospital 8:30 in the morning. With one of our connections, we met with the director of Tata Hospital. We got a signature and he told us to follow the same procedure which every other person in Tata Hospital is following. Okay, we were all okay with that procedure as well. We made our card. After that, we were sent to OPD to meet the doctor. You will not believe there are hundreds of people who are standing in queue to meet the doctor, to meet that hematologist, the blood specialist doctor. And we were there in the queue for minimum 4 hours. That is also fine. After that, we met the doctor. The doctor says whatever the details are there, we will not go through that details. We will have to identify few details from our side as well. Obviously, like any other hospital, Tata Hospital did the same thing. They started with their reports. He suggested us with CBC tests and some tests in which he can find out whether it is blood cancer or not. You will not believe, for that test we had to again stand in a line for at least 1 or 2 hours. My mother was already weak. She was there since morning 8:30 and now the time was around 6:30. You will say that we had not fed her on time or any such thing. But the reality is that we have to wait. We need patience. In Tata Hospital, we need patience. After the CBC test was done, we were asked to wait for more 4 hours so that the results can come and we can meet the casualty specialist who can guide us. Imagine, my mother was dealing with all this since morning. Somehow we managed to wait back till 9 o'clock in the night. We went to the casualty specialist. There We again had a line for 1 hour. 1 hour, 1.5 hours. When we got a chance to meet the doctor, the casualty specialist doctor, the doctor saw the reports. She was asking many questions. She in fact asked my mother to stand up and walk. My mother was able to, but we had given her wheelchair so that it would be convenient for her not to walk too much and waste her energy. Because since morning she was there, since 8:30, and now the time was around 10:30, 11. My mother couldn't take that, and the room which we were sitting in had no ventilation. She couldn't take that, and she was unconscious. Immediately the doctor had to admit her in casualty. You will not believe, the doctors said that her condition is really very serious and anything can happen to her any moment. Imagine you being a child and listening to this statement. It is so heartbreaking. She is in casualty, lying down on a bed. They asked us that whether we can start with chemotherapy. They actually do not do it, but because they didn't had their reports, they had only our reports which we had taken. They wanted to cross check, but still looking at my mother's condition, they were like they can start with chemotherapy. But unfortunately that night they did not. Imagine, the time was 12 in the night. The entire night she was hospitalized. We as a family all were there, so that at least the first chemotherapy we should be there and we should know what exactly is happening, how our body is reacting. The treatment was not started. Day 2, she's still there in the hospital. As it's the casualty room, there are patients coming as emergency and there are no beds. My mother was shifted to stretcher. One more point. Washrooms were approximately 1 kilometer away from the casualty. So imagine, if my mother had to go to the washroom, she had to travel 1 kilometer, she had to walk 1 kilometer, or with the wheelchair, she has to go to 1 kilometer and go to the washroom. That's fine. They asked us to bring medicines. We bought all the medicines required. We did all the possible things. We had so many connections. We had so much connections. We had sisters. We had priests who had spoken to the director. Many people. I don't want to name them, but there were many people who spoke to the doctor. But they said the same thing. Our protocol remains the same, and we cannot treat AML patients here because there is no bed vacant. Imagine, as a child or as a husband, what would we undergo, how pressured we were. I'll tell you, you cannot even imagine the pain those 3 days we were there at Tata Hospital. I'll tell you the last day experience as well. When doctors gave up and they were like, we cannot treat the patient in when doctors gave up and they said that we cannot treat this patient here, they immediately removed us from casualty. And my mother was out sitting on a wheelchair. Somehow, luckily, my friends were there, and it was really a rescue for us that they were there on time and had a car, so that I could manage and make her sleep for some time in the car. I tell you, we had a worst experience in Tata Hospital. I'll tell you the reason why they don't want to treat the AML patients. AML patients needs very, very, very intensive treatment. They need time to time checkups, CBC tests to be done, blood transfusions to be done, platelets transfusion to be done, many things which they knew that the bed is not available and we cannot give them the best support. Hence, they gave up. And we as a family we could not think about it. We had to save our mother. And my father had to save his wife. I know people talk so much about it. We have this connection, we have that connection, we can do this, we can do that. I tell you, try it. Try it out. If you get it, we are lucky enough. Thank you so much.